Hey everybody, I'm Congressman Scott Perry. Thanks for joining this afternoon's COVID-19 telephone town hall for constituents of Pennsylvania's 10th Congressional District. I just want to remind everybody listening that at any time during the call, if you have a question for me or our special guests, please press *3. That's *3 to get in the queue, and we'll take you right in order there. This afternoon, we'll be providing an update on COVID-19 in our community and discussing the new scams and frauds that are being targeted and targeting against us during this crisis, and some ways we can all keep ourselves protected, both from a health standpoint and from a financial standpoint, against some of these folks that are taking advantage of a bad situation. Now, I'm honored to be joined by two experts that are outstanding. Dr. Peter Dillon of Penn State Health. If you were on some of the other town halls, he joined us on April 1st in that Tele-Town hall, and we brought him back due to popular demand, so we're happy to have him. And as you might remember, currently serving as the medical and technical specialist at Penn State Health's COVID-19 Incident Command Center. So that's a pretty big deal, and he normally serves as the executive vice president and chief clinical officer at Penn State Health. So we're thrilled to have Dr. Dillon. We also have John Miller-Steiger, who is the director of the East Central Region of the Federal Trade Commission. The Federal Trade Commission, for those who may not be aware, the FTC is our nation's consumer protection agency, and they've been working tirelessly to protect our communities by they're looking at the spikes and scams and frauds during the COVID-19 crisis. And of course, you know, as criminals do things, you know, we have to react, and of course criminals try and change things very quickly. So I'm sure they've got plenty on their plate. As the director of the East Central Region, he oversees the education and consumer protection of law enforcement in Pennsylvania, Delaware, Maryland, Ohio, and a few other states. Now, we're privileged to have these two guests with us this afternoon. And again, I want you to remember to press *3 if you have a question. Now, I'm just going to kick it off with a question for each one of our guests, and I'm going to start with Dr. Dillon. Dr. Dillon, our healthcare providers on the front lines in the battle against COVID-19, and they have been working just endlessly since the outbreak began nearly 6-7 weeks ago now. How do you assess how our community right here in South Central Pennsylvania is doing in the fight against COVID-19?
Congressman, thank you for having me back, and I appreciate the introduction. And as you say, our healthcare providers at so many institutions in this part of the Commonwealth have been quite busy. And what we have seen over time, and this we've been predicting from models that have been published both through Johns Hopkins and the University of Washington and our own work, of a progressive increase in cases, and this was anticipated as we've seen in other parts of the country. One of the things I think that has been of great interest is that we probably haven't quite seen that peak surge that occurs or has occurred in other areas, other geographic locations, and in part that's going to be due to the fact that we did have social distancing. We got in many aspects got ahead of the infection, where we don't have as many dense population areas. And that's been a major factor, I think, in being able to manage the caseload, the infection load that hospitals have seen. Nonetheless, hospitals have been very busy with infected patients, and we're not through this infection yet.
Okay, that's some good news, and of course some news that we'd like to be better. And I'll have another question. I'll have some more in case some of our guests don't. But let's go to spend a little time here with John. My first question for you is, since the outbreak of the COVID-19, our communities we've become all targets for scams and frauds that want to take advantage of the anxieties and uncertainties and the lack of information surrounding the virus and different programs. what type of scams is the FTC identifying related to the pandemic, and how are we combating how are you guys combating these scammers?
Well, thank you very much, Congressman, and let me add my thanks as well to you and your staff for inviting me to participate in this town hall, and for all the listeners on the call as well. We are seeing a number of different scam areas, and unfortunately what we've learned in past situations, like in hurricanes or with Ebola and Zika, is that the scammers follow the headlines. And as you suggested, they are going to try and take advantage of people who are feeling uncertain, people who are feeling scared. And so we've been tracking complaints carefully, and what we see are some broad areas where the scammers are involved. We see scams involving treatments and cures. We see scams where they are trying to collect personal information, so they'll send out an email or text or set up dangerous websites that are there just to install bad software on your phone or your computer in order to harvest your personal information. We see government imposter scams where they are pretending to be relevant parts of the government that are dealing with coronavirus, but again, what they're really doing is trying to get your money, trying to get your personal information. And then the fourth general area that we see these scammers is in the fake charity scams. And these are particularly heart-wrenching because, of course, not only are they taking people's hard-earned money, but they're keeping that money from going to the charities who really need this money, especially now. And just very briefly, because we are a smaller agency, not a lot of people know a lot about us, although we have a huge footprint. We have two major missions in this area. First, we bring cases in federal court. We protect consumers by shutting down these scammers and try to get money back to the victims. And in fact, we've already filed one case against a company trying to take advantage of the help that Congress is providing through the Paycheck Protection Program. So we've gone into federal court and we're asking a judge to shut this operation down. We also send warning letters to companies that have put out the fake cures and preventions in order to get them to stop making those claims. But then the second part of our mission relating to COVID scams is educating consumers and businesses about how they can avoid these scams. And so I look forward over the course of this conversation to talking not only about the scams, but also about some of the tips that we have for people on how to avoid them.
Well, thank you so much for the overview there. And I think what I'll do, I do have questions for each of you, but they might be similar questions to some of our callers. So I'm going to just let the callers drive the train here. And if we get a break or whatever, I will have some questions for you as well. Laura, I know you're on the line. Do we have questions lined up yet, or should I just continue? Should I ask one?
We certainly have questions. Our
Yes,
first
ma'am.
question is from Robin H.
Hi, Robin. You're on the line.
Yes, my question is, it seems like the majority of deaths that I'm reading about are people with immune-compromised systems, that the relatively general population who's healthy, it's not affecting them. Am I right or wrong, or is that true or false?
Dr. Dillon, I think this is in your wheelhouse.
Yes, Robin, it's a great question, and one that we have learned a tremendous about over time now that we have been able to track the course of this disease as it goes through our population. But you're absolutely you are correct. What we know of is that, and these are rough figures, but perhaps 80% of the population, and this is seems to be holding true, that about 80% of the population, it's really just perhaps mild type symptoms, flu-like symptoms, headache, temperature, and the like, body aches. There is a group, perhaps 20%, that are serious enough that do warrant some form of support, and that's usually being hospitalized, requiring, IV fluids, things like that, because there is no, we can probably get to this, but there is right now no known treatment to block the virus. And then, yes, there's 5% or so that are really very, very sick, end up in the ICU. And for the most part, these are patients who are either immunocompromised, and when we say immunocompromised, that's a broad spectrum. They may have diabetes, they may have cardiovascular diseases, they have other aspects. Obviously, you think about patients with cancer. Patients who have had transplants certainly are at the highest risk. There is an age element there that, again, continues to play out in these studies, that the older you are, and again, we know that's because there are changes to your immune system with age, and that does lead to a higher risk for death, unfortunately, or a higher rate of mortality in that age group.
Hey, thanks for the question, Robin. Informative for all of us. Laura, do we have another question on the line?
Our next question is from Eric H.
Go ahead, Eric. You're on the line.
Okay. Hello. How are you?
I'm well.
Hello.
Sir. Yes,
okay.
sir. We hear you. Yep.
Okay, great. Okay, the question I had was concerning the numbers as being reported. We hear that we're tracking this COVID-19, but the numbers we're getting every day show the number of people that get it or infected by it and the number of deaths, but we never hear any information on the number of people that are recovering and no longer being treated. And my fear and concern is that I think this pandemic is being used to unjustly limit the freedoms of free people. And I think it's also kind of being used to possibly influence the results of the upcoming election. So I'm just wondering, how come we aren't seeing the actual hard numbers on people that are getting it, being treated, recovering, and returning back to normal? And the number just seems to increase as opposed to showing numbers of folks that actually recover and move on.
Doc, can you speak to that a little bit, and then maybe I can follow up on just your assessment of how it's reported and why it's reported that way.
Yeah, I'll point out that many of the hospitals, and we started this very early, was we report on our public website, for instance, the number of tests that are conducted and the number of tests that are positive in those people who come to see us. Realize, though, that does not reflect, we're not testing everybody, and it's only patients or people who come to us who may have symptoms after passing through that initial screening questions that were put in place in the very beginning. We also publish on a daily basis the number of discharges that we have from the hospital, and we do publish, as you pointed out, mortality figures. I am not aware of anyone that is actively collecting, for instance, the discharge numbers from a given hospital, at least as a public reporting mechanism. Challenge is that's not going to be a true reflection of the infection or the activity of the virus within a given population, because we don't, all the people who may have tested positive, shall we say, but are in that 80% of Robin's question earlier, those patients are home, and while they are factoring into the positive test number reports, we can only assume that they've all recovered. So I think you ask an interesting question, but that's going to be a very hard number to make any sense of in terms of the true challenges or issues that taking care of this pandemic infection poses.
Hey, thanks, Doc. And Eric, let me just add a couple things here. The policy initially, I think, coming from the federal government and then from the states and commonwealths, including ours, was initially to make sure that our healthcare system wasn't overwhelmed. And that was the concern when we looked at the experience that happened, initially in China. And so all measures were taken to ensure that occurrence didn't happen here, and that hospitals, for instance, stopped treating and doing other things that they'd been doing in anticipation. And so I think whether it was intended or not, the metric was set up to kind of report along those lines so we could understand, if that was indeed occurring and then make adjustments as things went on. Now, I will tell you, that's a question that we deal with in the office every day, and it's a question on a lot of people's mind. I do think that we have an incomplete picture of the circumstance. I think it is I think this can be deadly, and it's very concerning, especially if you're, as the good doctor has kind of discussed, in especially one of those circumstances where you might be compromised. And we know that the majority of fatalities in Pennsylvania have happened in elder care facilities of some type or another, and that's not a knock on the facilities at all. It's just, unfortunately, who's mostly affected, or the population is mostly affected by this, at least by the numbers so far. I think in time that we will get that, whether there's malicious intent. I wouldn't go that far, to accuse anybody of that, but I will tell you this: I'm very frustrated, as many people are, with the inconsistency of policy regarding the states, the federal government, states among states. The federal government does a pretty good job of determining what is a critical life-sustaining business and that type of thing, because we deal with natural disasters or disasters every single year that cross border state boundaries and so on and so forth. So, in this instance, including the Commonwealth of Pennsylvania, the Commonwealth is using its own guidelines as opposed to the federal guidelines. And so there's been a lot of questions regarding the consistency of why the policy is one way, why some places can do some things and other places can't. And, of course, that's all driven by the numbers as well. And we've also seen some of those numbers revised. So it does create, unfortunately, a healthy skepticism of the system. And I would just tell you to multi-source your information, Eric, regarding where you get. I certainly believe that we're trying to accurately report the cases and the fatalities and so on and so forth. But the other information that doesn't seem to make it to the mainstream is generally out there. But you have to look for it and then confirm it. No, it's not a great answer, but that's probably the best I can do at this time. Again, if you're listening, dial *3. Laura, do we have another question on the line?
The next question is from Michael R.
Hi, Michael.
Yeah, hi. Thank you. I'm quick on the line. Thank you for this opportunity. And my question was a two-part question for the gentleman from the Federal Trade Commission, and I apologize that I didn't register your name. One is, does the agency have sufficient resources to address the online scam issues that you spoke about? And the follow-up to that would be, do you have any awareness of how your agency's budget's been affected the last couple of years in terms of resources, whether they've increased, decreased, especially maybe on the enforcement part of it?
Okay, John, go ahead.
Sure. Thank you, Michael, for your questions on that. We are a smaller agency, but we are very well supported. We're a creation of Congress, not part of the administration, and we have very good historical support from Congress for our mission. So, we have the resources that we need. I think any company, any agency would be able to point to things that they could do if they had a little bit more, but it's not at all getting in the way of the work that we're doing. As I mentioned We are already, we've already brought a case in federal court, and we have other cases in the pipeline, even though, these, the false advertisements are coming up only in the last month or so. So I think that shows that we have the resources that we need in order to protect consumers out there.
Hey, John, and thanks, Michael. John, as a curiosity with the Federal Trade Commission in this unique circumstance, we as members of Congress hear that there are fake or fraudulent or counterfeit, however you characterize them, and I apologize if I mischaracterize them, but let's just say counterfeit cures, vaccines, treatments, etc. Is that indeed occurring? How do people know? What can they do about it? Have you run into it? What are you doing about it? What can you tell us about that?
Sure. Yeah, we unfortunately are seeing a lot of complaints about fake treatments, fake cures, even fake testing. We've recently seen evidence of scammers setting up fake testing sites, which again, doubly dangerous. Not only are they taking your information, your sensitive information, they're taking money, but they're also putting you at risk because these aren't medical professionals. So you definitely want to be careful when you're out there looking for possible protection and testing as well. And we see everything in terms of this. We see teas that are supposed to protect, an herbal tea that's supposed to protect you from this virus, bracelets that are supposed to protect you from the virus. And of course, there is no evidence at all suggesting that any of that is true. We've seen these same products be used for every ailment that gets the headlines. We see it in normal times for cancer, and then all of a sudden the same exact product now is being marketed as being able to prevent or treat coronavirus. So we know that those are not true. The things that we tell people to do in this area is to, first of all, just recognize that if there is some sort of breakthrough in terms of a treatment or a prevention, you are going to hear about it. You're going to hear about it from so many different sources. You're going to hear about it on the news. It's going to be, the top news story probably for weeks. So if you get an email or if you get a text that talks about one of these things, that's not the way that you're going to find out about a legitimate cure or a legitimate treatment or prevention. So we ask people to just ignore those. And then the second piece of advice we have in this area is before you give any information on a website or in response to a call, and before you buy anything, talk to someone you trust. We found that most situations, when you just take the time to explain, hey, this is what I read about, here's where I read about it, that you're able to, figure out that that's not a good way to spend your money. Again, the scammers are there trying to take advantage of our concerns, of our fears for ourselves and for our friends and our families.
Congressman,
all right, thanks so much.
Can I jump in?
Yeah.
Can I just add to that, because that was well stated, and there is so much, there's just tremendous amount of confusion right now, and so much that we still don't know. And clearly the whole area of testing is just such a hot topic right now, and there's a tremendous amount that still has to be done in this area before we have definitive answers. And to John's point, talking to somebody you trust, talk to your physician, talk to your family doc, and get their opinion or their understanding, or if not, reach out to, if you're in our area, our Penn State Health and our website, all the other institutions in Lancaster and Holy Spirit and Pinnacle and Geisinger all have areas of information that can help people understand what's currently going on in this area.
Excellent. And I'll maybe have another question regarding that testing for you, but let's see if we can take another caller. Laura, do we have somebody on the line?
We do. Our next question is from Nancy K.
Hi, Nancy. What's on your mind?
Hi, thank you for taking my call. I was wondering if at this time we can get a serology test for antibodies, and if so, where can we get the test, and if not, when do they think it will be available in this area?
Go ahead, Doc. You start.
Yeah, I'll start. And right now, that is still an area that a tremendous amount of work and information needs to be done. To be very blunt, if you will, nobody's quite sure what any of the serology tests mean in terms of infectious status, particularly related to this virus right now. And somebody quoted me I think it was just yesterday, there are more than probably, it was 70 companies that was mentioned to me, as I said yesterday. It could be, it could be 100 now that are trying to create a test related to serologies, as you've asked about, which is looking at how your body has made antibodies against this virus, and if you can tell from those antibodies what your immune status might be. And the reliability and the sensitivity of these tests are still poor. And so there's still a tremendous amount of work being done in this area before we can have a reliable test that the public can have its faith in.
And I would echo that, Nancy, and I thank the doctor. Actually, Nancy, Dr. Dillon and I were having a discussion prior to the call about exactly that, the serology testing, and the fact that there probably is some out there. I just got off a call with probably half a dozen different pharmacological companies talking about not only vaccines and serological testing, but treatments. So there are some out there, but again, the efficacy or the accuracy of those is still in question, and we got even into it a little further about how different tests are maybe accurate at one point in the virus's kind of transition through your body, and other ones are not, or it might work early but not late. It might work later but not early, depending on the life of the antibody, and so on and so forth. So, unfortunately, it is not. It seems ready for the industry is not ready for mass scale serologic testing. It seems like it'll be later this summer or early this fall, based on what I'm currently hearing on the daily calls. But and that's a concern as well, Nancy, because we kind of hear this narrative that we can't get back to any kind of normal life until this testing is widespread. But clearly the testing is just not. We just cannot jump time and make it happen as fast as we'd like to. It's got to go through the certain protocols for safety and then accuracy as well. So. Great question, and there are going to be numerous companies that are involved in that, Nancy. I will tell you that right now there have been more than 6 million tests in the United States. I think we're doing about 230,000 a day. There's a couple companies, Rapid Acceleration Diagnostics has been one that is moving forward, and then. It escapes me now. The one that if you go to the doctor and they do like a strep test, I can't think of the name of it right now, but we purchased, the federal government has purchased literally thousands and thousands of those machines, but I think they're limited to 4 tests per hour. Now that's not serology, that's whether you have it or not, but it is changing daily, but it's just not quick enough to really satisfy us, and I don't know that it is ever going to be at this point. So, and thank you, Nancy, for the call. Again, dial *3. Laura, do we have another question?
The next question is from Eric C.
Yes.
Hi, Eric. Go ahead.
Thanks for taking the call. Once in a while, it's a little hard to find, but I find the stats for every county, how many beds are available, how many ventilators are available, how many are being used, and how many are being used for coronavirus. And when I look at those numbers, it's so minute. Like, is this even a pandemic, and are we overreacting, number one? And now, I am in one of those categories. I'm over 65. I'm diabetic. Hypertension, and I've been treated for cancer. So I know I need to take some special precautions. But as a whole, just because we can't treat it and we don't have a vaccine, does that make it a pandemic?
Wow, I don't know. Yeah, go ahead, Doc.
I was
Definitionally, I'm not sure.
If you clearly looking at statistics in our area, I would say right now we have been very fortunate, and I think it's for a number of reasons. And as I was saying earlier, I think it relates to the fact that we did get ahead of it in terms of the factors that we know we can control, and the social distancing and masks and all the things that have been done. But to your point, I talked to my colleagues in New York and Boston and out in Washington, and they have had a totally different experience. The reports that we've all seen on in the media, whatever form that you subscribe to, can't explain and can't really deliver the true picture of the challenges that they've gone through with this infection. So I would say we're fortunate in that the pandemic has not swept through us significantly yet, but we also know that there are high-risk areas, the nursing homes, as Congressman Perry alluded to earlier, where it can be quite devastating, and the infection rates are quite high and still of great concern to us.
Would you say, Doc, that to a certain extent, like Eric makes a great point, but geographically and based also on population density and maybe the cultural norms of an area, like a city where people are very close together and they do things close together on a really regular, just almost an absolute daily basis, as opposed to an area that people aren't so densely packed. I mean, it just absolutely makes a difference of the experience, and so his description is probably valid for what he sees around him, but it might not be valid in other places. But it also, I think, brings up the point that informs policymakers like me and the governor, the president, et cetera, about how we deal with it.
Oh, absolutely, and I think one of the areas that has, one of the factors that's been in our favor is exactly that, the geographic dispersion that we have. Our populations are not as dense as they are in some of the major metropolitan areas. And what our researchers have picked up on in terms of this infection right now is that we're going to see hot spots. We're going to see the virus pop up in areas where there might be some level of population density, a town, a smaller city, a cluster of nursing homes where people in a, shall I say, a micro environment, if you will, are exposed to the virus and then can transmit it in relatively close context. And you're absolutely right. For our area, that's what we're going to see, and why our experience has been a little bit different than at the national level or even in other areas around the world.
Excellent, thank you. Okay, Laura, next question, please.
Our next question is from Michael M.
Hi, Michael. What can we do for
you?
Hello.
So yes, my question kind of, I'm sorry. My question kind of dovetails into the conversation we're having right now about antibody testing and how safe is it actually if we open up society without knowing the true extent of this. You hear a lot of information about, everybody's already had it, and we have the antibodies for it. So how safe is it without sort of a universal testing?
Doc, can you speak to that and maybe talk about maybe there's different safety levels depending on where you are? We do hear about certain places where they did some antibody testing and found out that a whole lot of more people than they expected apparently or allegedly were in contact with it. What does that mean, and what does that mean regarding Michael's question for safety?
Yeah, and that's, in some aspects I'm going to say, that's going to be a really hard question to answer, but a very important one, and one that's on everybody's minds right now. No question, Congressman, what you're alluding to are some of the tests that are now coming out of New York, and the experimental test, the studies that they're doing. And it was 20% or just over 20% had some level of antibody to the virus, which means they at some point had been exposed. Now, what we don't know is that giving them immunity to the virus, and are they perfectly fine while everybody else is at risk? We just don't know enough yet, and that's we're 8 weeks into really having the brunt of this pandemic, this infection. This type of question is going to be it's going to be asked multiple times over the next few weeks. People are working, very actively to try to give some type of answer to it, but it's going to come with time, and it's going to come with controlled experimental. Unfortunately, that I know people react to that. But it really is going to be investigational scientific studies that have to look at the antibody production in the face of this infection, and what the different types of antibodies, we all make multiple types of antibodies depending on the timing of the infection and how our body responds, and understanding what the different levels of antibodies mean in terms of the safety, if you will, from this infection. No question that at this point in time we don't have enough to say definitively that a certain level of antibody means you are totally free, or that you don't have to worry about being infected. That will come with time. What we do know is from these types of studies in other infections and other immunologic diseases, and extrapolate those results at this point in time, but it doesn't speak specifically to the challenges of this infection. Great question, and right now, unfortunately, the answer is we just don't know. It makes sense. It's understandable to be able to say, look, if you've got antibodies, you're protected from the infection. But that is still, we still need a tremendous amount of information before we can definitively say that as far as policies.
And so since we don't currently know, and we're trying to get to some level of normalcy for the obvious reasons, I think it just bears saying again that if you don't know, follow the precautions, which are, I know that people maybe are tired of hearing them. They seem rudimentary, but again, kind of keeping your distance a little bit. Coughing, sneezing into your elbow, and then and washing your hands more than you ever did in the past, and be careful with what you touch and what you do. Right? That we know that makes a difference, right, Doc?
Yes, and those are standard treatments that we've known to combat infections like these, over many decades, many years, and even, this is same information from the influenza that really was around the world in 1918, and hard to believe that, yes, there are things that we have recovered, if you will, from those studies that pertain today even. I think that this is going to change. Next week, we'll know more about the virus. We'll know more about serology tests than we do this week. And the pieces of the puzzle will continue to come together. And as they do, things that right now we're doing, shall we say, out of common sense and practical aspects in terms of how you treat infectious diseases will change as we learn more and more from this.
All right, thank you. Laura, next question, please.
The next question is from Kit W.
Hey, Kent.
Congressman Perry, thank you very much for the efforts you're making to keep everybody educated. Are you there?
Sir, thank you. Yes, sir. We're here. What? Do you have a question for us, or something on your mind?
Yes, I do. And it isn't actually related to everything I've heard so far today, but I've been on a couple early ones and didn't get a chance to ask my question. My question is, we have 700 clubs in Pennsylvania. I'm the adjutant for the Pennsylvania American Legion, and about 150 of them are small, we call them mom and pop operations. They have 100 members or less. Out of our 700 posts, we have about 150 of them that are really going to be struggling when we open back up. Are there any federal funds to help these small clubs, loans, whatever, to help them stay in business after this thing is lifted?
Yeah, Kent, let me ask you this, and I probably should know this as a member of both the Legion and the VFW, but is your organization classified a 501c3, or what is the tax classification of the American Legion posts, or most of them, if you know?
They're a 501c19.
C19. Okay.
Yes.
Boy, I will tell you, I am uncertain of. Hold on a second. Oh. Okay, Kent. If you can, we want to get back to you on that because I think we have the answer. I just don't have it in front of me right now, so we can get you the answer to that. And you're the adjutant, right, for the American Legion? Is that correct?
Yes, sir.
Okay, so we have an answer for you, and I think we did make some provisions, but there's all these different organizational structures under the IRS, and it's hard to keep them all straight, and I don't want to steer you wrong or anybody else wrong that's on the call. So we will track you down, I suppose, and get the answer to you, all right?
Very good, sir. I appreciate the effort.
All right. Thank you, sir.
All right.
Laura, next question, please.
The next question is from Christy C.
All right. Go ahead, Christy. You're on the line.
For taking my call. My question would be, why are we only one of 7 states that are mandating masks to be worn? When you watch the news and you look, I think everybody thinks everybody's wearing them, and that is not the case. And there just seems to be a lot of confusion about it, and I just would like to be on the record as saying I think it's wrong. My husband works in a tool and die shop. It is very difficult to try to work how he's working for 8-10 hours a day with a mask on. That really has been proven to it really does nothing. And if they were as useful as everybody says they are, to me, more states would be requiring it.
Let me ask Dr. Dillon this, only that he might have specific information that informed the State Secretary of Health regarding that decision. I don't know how they came to that conclusion. I know many people disagree with it, and of course, one of the problems is some people can get a mask, some people can't. I know that there are many industries that people expect somebody to be wearing a mask, like let's just say a convenience store cashier, and somebody walks in and they say, well, why aren't you wearing a mask? Well, talking to the convenience store folks, maybe they can't even get a mask for their employees because they're in such short supply, yet they're demanded to wear them, and customers expect them to wear them, but they can't get them. So, Dr. Dillon, do you know, have you talked to the Secretary of Health regarding that decision and how they came about it, or can you enlighten us all on the efficacy of the mask? Does it protect the person that's wearing it more than the other person around them, or vice versa, et cetera?
Yeah, masks are just a fascinating question and have been a significant challenge, if you will, in this whole pandemic. And part of the problem is, for so long, the important masks have been in short supply and difficult to get for healthcare providers when they're actually taking care of a patient where they are most urgently and most importantly needed. Congressman, to answer your question, no, we were not involved in any of the discussions related to, shall I say, state policy or comments that have come out. Now, we do know that CDC has recommended masks, and though they didn't actually mandate them. Here's what we told when the request from the governor came out in terms of our masking policy at Penn State Health. Here's at least what maybe I can shed a little bit of light on our discussion, because in some ways our caller, and I'm sorry I forgot your name, is right. Masks, originally the thought was that this is a virus that is transmitted by aerosolized droplets. In other words, you sneeze and the viral particles in all the little drops of saliva and such are there. And part of that is true. We also know that it's passed by touch and can be on surfaces and such. The masks themselves don't filter the viral particles. That is true. The reason that we have instituted a masking policy and went along and went with the recommendations is because from a wearer's perspective, at least the mask will cut down on, if you sneeze or if you cough, will cut down on the amount of aerosolized droplets and such that happen when you do sneeze. They go into the mask, obviously. So it really is trying to minimize within the environment the potential spread of virus or of the infection. But the challenge is viral particles can go through almost any mask except the most, I won't say the highest quality, but the highest level. N95s still have a certain percentage of viral particles that can sneak through until you get to respirator type protection. It's an interesting question. It's one that is I always put it in the category of trying to do whatever you can to minimize the spread of this virus by whatever methods can be done. And this is one where that really applies.
It is a great question that Christy asked, and let me just ask you a curiosity of mine, Doc. I travel with a mask if I want to do the right thing and show people that it's important to try and make sure that you don't know whether you're affected or not, because some people transmit the virus apparently when they're asymptomatic. So I go ahead and wear the mask because I just don't want people to be fearful that I'm not following the protocol. But I see people driving with a mask in a car by themselves. Is that doing anything? I hate to ask it that way, but what are your thoughts on that?
No, it's a good question. Yeah, that's not doing anything. The mask is if you are in the vicinity of others, if you're in an environment where there are other people around you, and particularly if you can't keep social distancing, if you can't keep the 6 feet away, then that's where a mask has some public health rationalization, particularly, again, since I've said if you cough or sneeze and there's droplets because of it. The other aspect of this is when you're alone or by yourself, no, you don't. The mask isn't going to provide you any level of protection, because it just, again, it's not of the caliber that will filter out the viral particles.
And then let me ask you this, because some people feel that they just don't want to wear the mask, whether it's uncomfortable, whatever the reason is. And of course, this is America. There's no, like you said, from the federal government, there's no requirement. It's a suggestion. But should we be afraid? Should we be, I don't know what the word is, of folks that don't wear a mask? Should we be concerned for them? Should we be concerned about them? Should we, I don't treat anybody any differently, but I think that some people are maybe offended, or maybe it's just a justifiable concern on their part if they see somebody that came into the store or what have you without a mask on. Is that something to be concerned about, or is somebody to avoid, or anything like that?
Well, that's a tough question for me to answer, because part of it, obviously, I think, hinges on one's personal beliefs, one's in terms of rights and such. So I certainly don't want to get there. The only thing I'll say is, and I'll just make it personal, while I realize that a mask at this point in time has, shall I say, minimal help or prevention for me. If I'm in a store and I see somebody without a mask, at this point in time, you don't know who's a carrier, and I certainly wouldn't want to be near them if they sneeze or cough. And so I think that's the challenge that we have, that you can argue that the mask in that situation can help prevent or minimize the chances of spreading an infection, but it is a very tough question, because this virus can be transmitted in so many different ways. But yes, at this point in time, just because of the nature of the infection and realizing that this infection is not over yet, that anything that I can do to minimize my risk, I think, is worthwhile.
Okay, thank you. And while we have John on the phone, let me ask you this: in the realm of the scams and so on and so forth, have there been any scams related to the economic impact checks, or direct deposits, but maybe particularly the checks, because they could be subject maybe to somebody kind of intercepting them or what have you? Have there been anything that has there been anything that we need to be concerned about with those? I guess they're oftentimes $1,200 checks or what have you, and of course everybody knows they're out there and so on and so forth. Is there any particular thing going on with them?
Yes, thank you for asking. There is a lot of bad behavior trying to take advantage of the fact that we know that the checks are coming, that there is help that the government is providing both to individuals and to businesses. And the scammers know that, and so they're going to try and take advantage any opportunity that they can. So we are already seeing that some scammers are reaching out to people and saying that they are maybe with the IRS, and in order to get your check, you need to give them certain information. So they're calling people or emailing people or texting people even, saying that, hi, we're with the IRS. If you want to get the money you're entitled to, please confirm your Social Security number, or please confirm the bank account that we're going to deposit it to. So those scams are already out there. The good news is there is a simple message that we hope people will share with their friends and family. First of all, to be on the lookout for these scams, so that you won't be surprised if one comes. Your friends will be able to think more clearly. But secondly, the bright line rule is that the IRS is not going to call about these stimulus checks. And there is already a procedure in place, well thought out procedure in order to make sure that the IRS knows exactly who gets what money, and they pay it in the way that they already know to pay to a taxpayer. So you're not going to get a legitimate call from the IRS or from any other government agency saying, in order to get the money that you're entitled to, you have to give us some information or you have to give us some money up front. So please tell all your friends and family. The fact that you all are on this call means that you are very well informed and interested. There are so many of your friends and family, though, who aren't as well informed. And so even just telling them about that these scams exist is going to save them a lot.
Hey, John, let me ask you this. As much as you probably wish that we all had your name and number, in our contacts on our phone, let's just say somebody gets a phone call or maybe something's in the mail, see something online regarding, the whether it's the Paycheck Protection, the EIDL loans, or any of this funding coming from the federal or state government. Do they contact their bank, the police? What a normal, I hate to say normal, but I mean, we just don't have your number in our contacts. So what do we do? Who do we report this to? What's the protocol? What rules are there? How do we do this?
Well, that's such an important question. And no, I'm not going to give out my personal number, but the agency makes it very easy to contact us. And when you come across anything that even if you're not sure and you think it just seems off, we really want you to file a report with us. And I will give two ways to do that. One is our website, which is FTC, for Federal Trade Commission.
Another question. You're going to have to hit something.
FTC.gov/complaint is a place where people can go to file complaints. And then a toll-free number, which is 877-FTC-HELP. So anytime you see something, please report it to us. It gets entered into a database that's actually accessed by law enforcement at the local level there in Pennsylvania, at the state level. National agencies like the FBI access this database, and also international law enforcement as well. So anything that you see, if you file a complaint with us, the proper authorities will be able to get to it.
Well, I sure appreciate it. It's just, you can imagine it's not something that you normally think of, and probably, unfortunately, folks don't think about it until they've already had an issue, right? They don't really think about it if they even suspect someone's trying to do something nefarious. It's just not something that's right on the front of our list to do. So I appreciate the information. Again, I would just encourage anybody that's listening, if you have a question either for the doctor or for John at the Federal Trade Commission, to just dial *3. Laura, do we have any more questions on the line?
Yes, we do. The next question is from Jeffrey L.
Hey, Jeffrey.
Hello.
Hello, Jeffrey. Go ahead.
Yes, Scott, I just wanted to know whether or not they were testing at senior living facilities and nursing homes. Both my wife and my daughter actually work there. My mom's 99 years old, and she lives there, and there's been several patients that have had COVID-19.
Well, I'm going to let the doc weigh in, and then I will tell you what I think I believe the policy to be, both from the federal government and the state government. Doc Dillon, do you have an opinion or any knowledge on this?
Yeah, I can speak to, certainly based on the nursing homes that various physicians at Penn State cover. The testing will be and is really institutional policy based, and so but most of them, certainly the ones that we cover, are following the recommendations of our physician staff who are responsible for the medical care of those residents, whether they're in assisted living or a residential retirement. They're following the recommendations of our medical staffs in terms of the screening, the questioning, and then if there's any concerns or suspicions, then they go on to ordering the tests, and it's as though they were in any doctor's office.
So it's my understanding, of course, from the federal government that obviously there's limited access, and the state government has followed suit with that. But in that regard as well, for even practitioners, daily screenings, whether it's temperature testing or otherwise. And listen, if your family members have a different experience, we should know that to make sure that the policies are being borne out and utilized, and I hate to use the word enforced in that regard because these are still private institutions, but these are also directives from either the state or the federal government, and we'd want to know if that's not happening. And then, of course, if there's any suspicion whatsoever of a case, then that's gonna I think dramatically change, based on what I understand, the protocols for that institution. And anybody, and you probably know this, in many of these similar institutions, they have visitors that, whether they're physical therapists, and not to identify any particular practitioner, but you understand what I'm saying, that maybe travel from location to location to provide healthcare services to the patients there. That's a potential issue that has to be dealt with. So it's my understanding that there's a very robust protocol for those facilities. But Jeffrey, if you know something other than that, please let me know. I suspect Jeffrey maybe has gotten off the call. So, Laura, do we have another question?
Our last question for tonight will come from Ashish A.
Ashish, good to talk to you. What's on your mind?
Hey, I just wanted to thank you for doing this, kind of trying to spread some more information. So my question is, it seems that the questions around this virus and its relationship with society hinge on our knowledge of who has this and who is at risk. And all of this seems to come down to knowing who has the virus and who has had it. So what do you guys think is the largest barricade or barricades to increasing the number of available tests?
Doc, I'll let you start, and then I'll come in behind you.
I'm gonna free think on this just a little bit. So I'll say let me preface it with no particular order of the importance. But first off, we need a reliable test, and I think that's the biggest challenge. You've heard that. I think through the course of this conversation, and it certainly, John and the FTC are quite worried about that, and I'm sure would agree with that as well. Once you need a valid test that has a rational, or shall I say, a easy and efficient way of being delivered to the public, to people who want the test, with results that are interpretable and can be understood by all of us. And then the challenge becomes, how do you create the supplies and the supply chain to support that? And those have been the very broad barriers that we still face, in that we don't have a reliable test yet, and since we don't have a reliable test, we don't know how to interpret it and how to deliver it to all of us so that we can be tested and then understand. And that's what's the most important. If we get tested and do we need to be tested once? Do we need to be tested weekly? Do we need to be tested every 2 months? There are just still so many questions. First and foremost, we need a good test. And that's coming, but we need more time.
Yeah, I would say and agree with everything Dr. Dillon has said. And I think, and correct me if I'm wrong here, Dr. Dillon, one of the issues is we don't yet really know exactly how long the antibodies last once your body's created them. So it's hard to know, like you just said, do we get tested once a month, once every 6 months, 2 months? And so one of the biggest barriers, and nobody's going to like this answer, but it's just reality, is time. We need time to sort these things out and figure out what works, what doesn't work, how this virus reacts, how it reacts to temperature and spread, and how long it lives on different kind of surfaces. All that informs us about what's going to work. Now, I will tell you from my perspective, at least now, at this current time, it doesn't seem to me that funding is a barrier. We have, in the most recent package, another $25 billion for testing, for treatments, and for vaccinations. And literally, the call that I got off of before Ashish, before getting on this call, was with I think half a dozen pharmaceutical companies located here in the United States, but some with affiliates overseas, Germany, France, et cetera, that are working on literally. They're working on human trials right now, and they expect to have product probably late fall, whether that's testing, whether that's treatment, or literally whether that's vaccine as well, which would be record time. So, and as the doctor had spoken about, we have 70 companies right now. Actually, I think it's more than that, working on different forms of tests. Some of the companies that were on the call before this one were actually producing in the terms of billions of doses right now, in anticipation of positive results of the trials. And so they're pretty confident that we're going to have the stuff that we need. But even at that, even at a record level, and you should also know that the President Trump's administration has enacted, I think they call it like a warp speed testing program and a vaccination program, where they're using and pardon me if you've never seen it, the Shark Tank model, to try and encourage the different organizations and companies to come up with these things. And there's a pretty, I think it's $500 million an award, so to speak, to bring this stuff to market as quickly as possible. So I don't think the barrier is really funding or really know-how. I think that the companies have the know-how. They're working through things. They're very, very promising things right now. You probably heard the news about remdesivir and the promise that's showing right now. And moving forward on the trials with that. So I think really the issue for us right now, because this is new and we were caught off guard, obviously, and it's dangerous to the point that we know that it is. It's time, and it's just information. Those are our two barriers, and even at that, it looks like we will have a vaccine, and based on what you're hearing, I would say in record time, probably inside of a year. And when we're already doing clinical human trials right now, understanding that means that we already know that the vaccination or the test or the treatment is safe, and now we're looking to see how successful it is. Is it 95%? Is it 50%? What have you? That's what we'll do, and it'll take some time to run people through the test at the appropriate numbers so that we're comfortable, and then publish the results, and then scale to production. And literally, these companies, like I said, are already in the process of producing billions of doses in anticipation of positive results. So, anything I got wrong there or out of step, Dr. Dillon?
No, I think you summarized it quite well, and there's great hope on the horizon. a tremendous amount of work, as you outlined, is being done and resources focused on it. And as you said at the very beginning, I think, we need time.
Yep, unfortunately. And in the meantime, we've got to try and get folks back to work. People are losing their livelihoods, and our office is working through that every single day, dealing with that, and we've got to find a way to keep things together at the same time we stay safe. I want to thank everybody that's on the call. I particularly want to thank Dr. Dillon and also John from the Federal Trade Commission for their time today, and being willing to take the hard questions and provide us some answers. For those that are concerned about the scams, John, can you just go ahead and give us the contact information for the Federal Trade Commission one more time?
Yes, absolutely. So there's two websites I would point people to. If they have a complaint, if there's something that seemed a little fishy they want to tell us about, that's ftc.gov/complaint. And then just for information generally, if you maybe have forgotten some of what I said or you want to share it with your friends and family, we have one website for all the coronavirus-related information that we have, and that's at ftc.gov/coronavirus. So those are the two places I would point people to. Thank you very much.
All right, excellent. Well, I thank you for that. One last question for you, Dr. Dillon. We sure appreciate your taking the time out today. Regarding some of the stuff that John had talked about, maybe scams for testing, I can't imagine anybody doing that, but apparently there are people that are willing to. When you get a script from your doctor, when you get the approval to go get a test, do they recommend a site, or and maybe they don't want to, but you could, I imagine, certainly ask, and I suspect you're aware that our local company here, Rite Aid, probably many of your pharmacies are independent pharmacies are conducting tests. How does that work? Do you recommend, or I'm sure you can answer questions if people ask, and obviously we should probably encourage them to ask based on John's information.
Yeah, I think the key is that they ask their healthcare provider what that person recommends. With us, we have been recommending our testing, if you will, on the premises at HMC, which we are slowly building up. But there are also some commercial labs that we routinely go to and will recommend. So it does depend on the location, where there are testing sites, and what your healthcare provider is comfortable in with the results and with the efficacy of the tests. And there are a number of good commercial companies out there. I'm not saying that everything is still in question. No, the viral testing units that are out there are good and very helpful. You do have to just be careful and go to a reputable commercial vendor, and your healthcare provider can provide you with that name.
Excellent. Well, again, thank you for all your time this afternoon, and for everybody listening. Just wishing you all the best and asking you to follow the protocols as much as you can. And certainly to reach out to our office at any one of the phone numbers. We are working around the clock on your behalf. And if you have a question that we need to answer or get you in touch with somebody, that's what we're here for. So whether it's a healthcare practitioner, the Federal Trade Commission, or something regarding the Small Business Administration, the Paycheck Protection Program, EIDL loans, etc., please absolutely reach out to us and let us see if we can help you through this. And hopefully, with the governor's announcements tomorrow, we can see some light at the end of the tunnel. So I sure appreciate you, and thanks again for the opportunities to serve, and I wish you all the best. God bless you. Have a great evening.